Good afternoon, and thank you for joining us for this community briefing on our local COVID-19 response efforts. I want to also thank Margie Prop for once again providing her services in interpretation. This week, we celebrate the shot seen around the world as a British grandmother became the first person to roll up her sleeve and receive a COVID-19 vaccine. Yesterday brought hopeful news closer to home as the Food and Drug Administration's Vaccine Advisory Panel formally recommended that the FDA authorize the Pfizer vaccine for emergency use. With that authorization likely to come in a matter of days, we could see a limited number of doses arrive in Nebraska as early as next week. The vaccine will give us another critical tool to stop the spread of the novel coronavirus, and we are grateful to the scientists and researchers around the world who have worked so hard to bring a safe and effective vaccine to humankind. We likewise appreciate our community COVID-19 Vaccine Advisory Committee and our community partners who are working diligently with our health team to prepare for vaccine distribution. Later in this briefing, Health Director Pat Lopez will share more information about the vaccine and our work to get it into the arms of Lincoln and Lancaster County residents. We encourage everybody to get vaccinated as soon as the vaccine becomes available to them. The phased shipment of vaccine means it will take time to get enough people vaccinated to stem the spread of the virus. And public health experts acknowledge that the pandemic will likely be with us for many more months. And during this time, particularly as we step into winter and more time spent indoors, we all must redouble our efforts to prevent the spread of the virus to our loved ones and our community, and to help protect our healthcare system. Let's not lose focus now that the vaccine is within reach. Let's continue to minimize contact with others from outside our households and avoid unnecessary activities outside the home. Let's wear our masks and let's keep 6 feet distance from others and wash our hands frequently. Let's work from home if possible and continue to only visit businesses and participate in activities that honor public health guidance. Taking these precautions continues to be important as our COVID-19 risk dial remains in the red, indicating that the risk of community spread in Lincoln-Lancaster County is severe. While the risk of transmission is severe and case counts remain high, we continue to lose members of our community, relatives, friends, and neighbors to COVID-19. On Wednesday, we reported 7 individuals in our community died from COVID-19. The highest single-day total so far during the pandemic. In the first 11 days of December, we have lost 39 Lancaster County residents to COVID, and on behalf of everyone in Lincoln, I offer condolences to the friends and families of those who've been lost. Health Director Pat Lopez is here. She'll share more about the indicators and information regarding the vaccine. Over to you, Director Lopez.
Thank you, Mayor. Last week, we told you that November was the worst month of pandemic in Lancaster County. We saw over 7,000 new positive cases, and we lost 34 members of our community to COVID-19. We also saw the highest number of hospitalizations and the highest positivity rate. This week, we are seeing some improvement in the indicators, but not enough to move us out of the red area on the COVID risk dial. This chart shows how all our indicators are factoring in the setting of our dial. We have no metrics in green, testing turnaround time is in yellow, connected cases and contact tracing are in orange, and the remaining metrics remain in red. You will find the location of the risk dial still in the red section, represented by the blue square outlined in red. For the week ending December 5th, we saw 2,103 cases, another weekly high. Today, we are reporting 171 new cases, bringing our total for the week to 1,139 new cases. This means we are on pace this week to have the first decline in weekly cases since the week ending September 19th. 1 week is not a trend, but this would break a streak of 11 consecutive weeks of either level numbers or an increase in cases. On another positive note, we are also seeing a drop in our positivity rate from the all-time weekly high of 33.9% the week ending December 5th, down to 27.4% so far this week. This is still very high, but it's good to see a decrease, and we haven't seen a significant decrease since the week ending October 10th. Today, there are 116 COVID-19 patients hospitalized in Lancaster County, with 14 on ventilators. 70 are Lancaster County residents, and 46 are from other communities. While the number of individuals with COVID-19 who are hospitalized continues to be high, we are down from the highest number of COVID-19 hospitalizations we saw on November 29th, with 177 patients. In the past several weeks, we have also seen the highest number of cases being reported among our long-term care facilities. This contributed to the recent high in hospitalizations and deaths. However, we haven't seen any additional outbreaks in long-term care facilities this week. We continue to work with these facilities along with the ICAP, which is the Infection Control Assessment and Promotion Program from the University of Nebraska. They connect quickly to work with facilities on infection control precautions and protocols needed to mitigate the spread of the virus and support the staff in the care of the residents impacted, along with the work we do at the health department. Testing has been consistent over the past 4 weeks, with an average of 6,350 people being tested each week. Over the past 4 weeks, Test Nebraska has conducted about 40% of our Lancaster County tests, and they are expanding. The number of daily test slots has increased from 800 a few weeks ago to 1,100 last week, and now we are at 1,500 this week. We are fortunate in Lancaster County to have testing widely available. It is an effective tool for identifying outbreaks and reducing the spread of the virus. But remember, this is not a panacea. Testing reduces risk, but does not eliminate it. It's not a substitute for preventative action. And those who are tested also need to remember that quarantine is highly recommended in between getting the test and getting the results. As the battle of COVID-19 continues, having vaccine available is truly a game changer. The vaccine will prevent illness, save lives, and put us on a path to the end of the pandemic. As the mayor said, we encourage every Lancaster County resident to get vaccinated as soon as vaccine is available to them. Yesterday's vote by the Food and Drug Administration Advisory Panel to approve the emergency use of Pfizer's COVID-19 vaccine sets up the final decision from the federal agency. Once the emergency use authorization, or you'll hear it many times said the EUA, is issued, vaccine can be shipped to states. But shots can't go into the arms of the public until the advisory committee or immunization practice conducts its review. The committee then decides whether to recommend the vaccine to CDC, and if that's the case, the committee finalizes the initial groups receiving it. Emergency meetings are scheduled for today and Sunday. A second vaccine option may not be far behind. The FDA panel will be meeting next week on the Moderna vaccine. Part of the approval process is related to vaccine safety, and when vaccine is available, it will be effective and as safe as possible. While vaccine development and approval occurred at an accelerated pace, no shortcuts were taken in the evaluation of the safety. Advancements in science, significant investment by the federal government in vaccine development, and the very large clinical trials have made this possible. If approved, Lancaster County expects to receive an additional 3,900 doses for our community next week. It has been a very busy week as we prepare to receive and administer COVID vaccine in our community. We have been working for months with our Community COVID Vaccine Advisory Committee, and many other partners to plan and prepare for the arrival of the vaccine. The advisory committee met yesterday and was updated on the latest information and discussed prioritization of the vaccine and distribution plans. Early on, we will have a limited supply of vaccines, so we will use a phased approach, which starts with phase 1A. In phase 1A, the very first doses will be offered to essential healthcare personnel and local emergency medical technicians. As the supply increases, we'll move into phase 1B. Vaccine will be offered to additional priority groups like firefighters and police officers, correctional staff, and other essential workers. Next comes phase 1C, which includes adults 65 and older, those with underlying medical conditions, incarcerated populations, and individuals experiencing health inequities. As doses become more plentiful, more people will be able to receive the vaccine. As vaccine is received, the goal is to get it into the arms of Lancaster County residents as soon as possible. But vaccinating our entire population will take time. 2 doses of COVID-19 vaccine are required, and those are given 3 to 4 weeks apart. We will continue to share the vaccine-related information as it becomes available, and we ask for people's patience. Please know that the health department and our partners will be vaccinating as many people as we can, as soon as we can, based on the number of doses provided. In the meantime, we continue to take the necessary precautions to protect everyone in our community. Broad community spread exists, and your risk of contracting COVID-19 is dependent on the choices we all make. We've been reminding you that the actions of one person can impact an entire community, and this animation illustrates how that happens and how the spread can be stopped by those doing the right thing. One person can start a chain of events that lead to hundreds of others being infected. But the actions of just a few can change the outcome dramatically and prevent further spread. It might be a person being able to work from home, a person who chooses not to attend an indoor gathering, or someone deciding not to travel. A person doesn't feel well staying home. Please remember that your personal choices can affect many others in our community. Wearing a mask, keeping your distance, and washing your hand help protect everyone. So does avoiding the 3 C's: crowded places, close contact, and confined spaces. When you ignore these precautions, you put not just yourself at risk, you put the health of everyone you encounter at risk, your family, friends, coworkers, and even strangers. As someone who has had the virus, I can tell you, you do not want to have COVID-19, but you also do not want to be responsible for passing the virus on to someone else. As we've been saying since the first day, we are all in this together.
Thank you, Director Lopez. As we've mentioned during many briefings throughout the pandemic, this is a rapidly evolving situation, and we have just had an update to our dashboard. And I want to clarify that today's case numbers are 179 new cases of COVID-19. That's a correction to information we just shared with you earlier in the briefing. As we enter this holiday season, a season of joy, celebration, and giving, let's keep our health and the health of our loved ones at the top of our wish list. The safest way to celebrate is to celebrate at home with the people in your household. Fewer, shorter, and safer interactions will help ensure that everyone you love can be present once again at next year's holiday celebrations. This simple chart shows how risk increases depending on the wearing of masks, the location of the gathering, and the size of the gathering. If you take part in a large indoor gathering with unmasked guests, you clearly increase the risks and the chances of getting or spreading COVID-19. This year, while the holidays may look different, that distance between us doesn't need to mean that we're disconnected. Continue to reach out and connect with those you love, but do so safely. Let's focus on what we can do safely. Consider virtual celebrations with family and friends. Socialize on video chat where you can play games, watch a movie together, or share a meal. Plan outdoor activities. Enjoy a walk or a hike. Take the kids to a playground or a picnic if it's warm enough outside. And thanks to the hard work of the Lincoln Children's Zoo and our health department, the Zoo Lights event is back on, and that is a great way to safely celebrate the holiday season. If you do choose to travel or celebrate with people from outside your household, which again does increase risk, you can manage the risk and reduce it by keeping the group small, by making sure you have room for guests to distance themselves from one another, and wearing masks when not directly consuming food or beverages. Be a leader in those kinds of gatherings. People often do what they see, and if you lead the way, they will follow. You can find helpful resources on our city's COVID-19 response website, covid19.lincoln.ne.gov, including a safe gatherings checklist and a conversation guide to use when you're making decisions about holiday plans. By working together and honoring our protective measures, we can celebrate safely and spread warmth, kindness, and holiday cheer without spreading COVID-19. And remember, the gift of a vaccine is coming, and next holiday season will be better. With that, we'd like to open up for questions from the media.
Mayor Riley Johnson, Lincoln Journal-Star.
Hi, Riley.
Hi, either for you or Director Lopez, the noted decline, what do you attribute that to?
This will be right up.
Well, Riley, we do know that we've really been focusing on increased measures and some other activities in the community. So we really feel that part of it's attributed to the community response to recognizing that we were really stressing the hospital system. However, we are continuing to encourage people to go and test and get testing that need testing. Our testing has been down a little bit, but we really see this number going down attributed to some of the changes we made in the community and the community's response.
As a follow-up, Pat, obviously the current DHM expires on the 18th, correct?
Correct.
Are at this juncture, are you considering relaxing some of those restrictions, particularly those on bars and restaurants?
Right now, we're currently reviewing that, Riley, and we will relax restrictions based on what's really happening in the community, where our positivity rate and our case numbers are. So just like we've done with the sports activity, we set that 3-week timeline. We did a review and we worked on it. We're doing the same thing now with bars and restaurants.
And Pat, on that note, is there one factor chief among them that is sort of your linchpin in decision making, or because I guess some people who aren't in the decision making process may see it as arbitrary in keeping one or the other. What are you going to be looking at?
Well, we're looking at our case numbers, our age groups. We're looking at what's happening with our hospital, our healthcare system availability, the number of positive cases we have. All of those combined, we have never just looked at one piece of data, because what we've been talking about is wide community spread. And so we've focused on areas where we can reduce gatherings and people being in close contact with each other. That's, I think, has been really clearly shown in all the data is the best way to reduce the spread, along with the masking and washing our hands.
We certainly want to thank everyone who has helped turn around some of our numbers. We're really grateful to our community for honoring the measures and for taking action that is helping to change the curve. Lincoln and Lancaster County residents have continued to rise to the occasion when we've called for their help, and for that we are truly grateful. I would also just add to the question you had about how things are decided, in the absence of perfect data, because in a pandemic the data is changing and it is not always, we've had technical problems receiving data from the state. In the absence of perfect data, we look at multiple lines of evidence. So we look at what we know. We have evidence about how this virus spreads. We know that it spreads through droplets of transmission, through close contact, that people are more likely to become infected if they are sharing airspace in close contact with others who are infected. We know and have multiple lines of evidence from across the country, all around the globe and locally as well, that places where people are gathered and unmasked are more likely to be sources of transmission. And we know that bars in particular, and restaurants where people remove their masks for periods of time and are in close contact, are some of those higher risk situations. And then finally, we know that by wearing masks and by keeping distance and by avoiding those kinds of gatherings where people are unmasked, we can reduce the transmission of COVID-19. So these multiple lines of evidence are what we utilize to inform decisions. And that's true of public health officials and health departments across our country. Other questions?
This is Brett with Channel 8. I have a question for Director Lopez.
Yes, Brent?
One of the requirements for youth sports to resume was they would have to report any positive cases to the health department. How many have you received, if any?
We haven't received any this week as of yet. And as you know, Brent, most of them are just in the process of starting to be active again. I think we've approved over 78 plans, 76 or 78 plans for youth, and probably, I think we have 3 that are pending that we're working on. We've had just a tremendous opportunity for engagement with those who are working with our youth across the country, across the community and the schools. So we're going to be closely monitoring that, and we'll let you know if that changes.
Thanks.
Director Lopez, Riley at the Journal Star, with a DHM related question. Earlier in the pandemic, the health department issued closure orders for violations of the DHM. At this juncture, have you issued any more closure orders? I know some facilities that have been in violation have just more or less received repeated tickets and not been shut down. Did you change strategy there?
No, Riley, I'm going to have our city attorney, Johansi Christie, address the process that we're using right now.
Hi, Riley. We do have a process, and that has, I do think it's fair to say that it has evolved somewhat, or, we have revisited the process several times since the very beginning of the pandemic. But part of the options that remain available do include a closure order.
Essentially, I mean, if you issue enough tickets, are you going to try and consider them a nuisance? Is that the thinking legally, that that's an option? You could go for some sort of nuisance injunction or closure order, or are you keeping them separate?
Well, without getting into too much of the specific strategy, because a lot of it would be case by case, or could be at least somewhat dependent on the specific facts of each individual case. But I would say that all options are on the table. But more importantly, we want the community to come together and try to do what's right to stop the spread of the disease. We want everyone to work together, and we also would like our businesses to be able to operate as much as possible throughout this as well. So we're really trying to balance all of that.
Are there any other questions?
Yeah, this is Jared Austin with 1011. I have a question for Pat.
Okay.
Hi, Jared.
Hi, Director Lopez. You had mentioned that starting next week is when Lancaster County could start getting some vaccines. Do we know at what point or how many vaccines the county will need to start making them open to the public?
You know, we're operating, our vaccine need is based on our population. So if you start looking, what we're hearing, but we haven't actually received that formal notification, is that those 16 and over are going to be eligible to receive the vaccine. So our first grouping is going to be our healthcare personnel and our emergency medical technicians, like I said. So we hope as soon as Monday is possible, between Monday and Wednesday sometime, we're going to be receiving our first allocation of Pfizer vaccine. So we have a priority listing of getting our healthcare providers and our emergency medical technicians started on that road. And then we'll just continue to work through that. It may be, depending every day, the amount of vaccine we may be receiving in our state, and therefore down to our community, changes. So we'll keep you aware of what's happening. We're hoping that by the end of December that we receive about 100,000 vaccines into our state. So we're hoping early in January that we'll be finished doing all of our healthcare personnel, long-term care, assisted living, and all the staff there, and start then moving into the other groups in our community, like our law enforcement officers, our teachers, all those other areas, Jared. And once we get through those, so maybe March, I'm hoping sooner, we're going to be ready to go so that we can keep getting vaccine as often as possible and as soon as possible. But it might be March now before we're able to go out into the general population, because we will be looking at those with underlying health conditions as well in those earlier opportunities for vaccine.
All right, thank you.
Any further questions? All right, seeing none, thank you so much for tuning in. Thank you for caring. Thank you for leading the way forward and helping us to start to turn around some of these trends. Remember that the risk is still severe, but together we can be more powerful than this virus. Have a safe and healthy weekend, everybody.